Foodborne illness and hygiene-related issues are rampant in many developing or low-income countries. Some of the top prevalent diseases in these countries come from things like contaminated food and lack in personal hygiene. And this is due to lack of knowledge and resources. It can be caused from inadvertently ingesting fecal matter, protozoa, eggs, bacteria, or viruses by touching the mouth with dirty or improperly washed hands. It can also be caused by washing foods with untreated water, cross-contamination of raw and cooked items, improper cooking, storage, and refrigeration, unsanitary cooking tools and utensils, and poor hand hygiene. In Ecuador and many other countries like it, foodborne illness and poor hygiene can cause, among other things, the main one we discovered is diarrheal disease, which can be fatal, especially to children under the age of 5. And the important thing to note is that foodborne and hygiene-related illnesses are preventable. And our group is going to focus on finding a solution to the spreading of foodborne illnesses and illnesses caused from the lack in personal hygiene. And through this program, we're hoping to increase the quality of life for many who live in Ecuador.
Morbidity is the rate of disease in a population. So these are the top 10 rates in 2009. For our project, we're focusing on number 2, which is diarrhea and gastrointestinal diseases. So what causes these? There are a lot of different causes, not just the ones listed here, but these are the ones that we're focusing on. And the biggest one we're focusing on is that it can be caused by bacteria or parasites found in food and water. So the 2 biggest things we're focusing on, the first one is hand washing, because it's one of the easiest but best ways to prevent diarrheal infections. I'll talk a little bit more about it later. And then safe food preparation. One of the things that I wanted to talk about was the health units that Ecuador already has in place. They have it's called the Ministry of Public Health, and they have bigger hospitals with specialties, and then they have general hospitals, basic hospitals, and it goes all the way down to small clinics. And which type of hospital or public health center just depends on how big of population it's serving. So the reason that I wanted to bring this up is just to show that Ecuador already has a pretty good organizational system. They're already actively addressing a lot of the problems that we're talking about. And so our solutions that we came up with, we tried to come up with solutions that went hand in hand with the programs already in place. So that we're not starting from scratch. We already have a lot to work with, a lot to go on, and we're also not trying to replicate something that they already have happening. So here's a map of Ecuador. We put this in here just to show Quito is this top corner here, and Guayaquil's right here. And Ecuador is a pretty small country, so no matter where you are in the region, you're only a couple hours from one of them. So what we wanted to do is have kind of champions from different areas of the country meet together for training seminars in Quito and Guayaquil. And there we would basically teach teachers. So we would teach people and make them kind of champions of these issues, and then they would go back to their communities and implement them. And then this way we can teach more people at the same time, but also each community will have kind of role models that they can go to ask questions with, and if those role models have questions, there's other people near them or in Quito and Guayaquil that they can refer those questions to. And in that way, we don't teach a lesson and then walk away. We actually get some feedback as to what's working, what's not working. So like I was discussing earlier, one of the biggest things we're focusing is on hand washing, because it's one of the easiest and most important ways to avoid diarrheal and vomiting related infections of people in all ages. So we made some interactive lesson plans, and they're pretty simple and adaptable. It's just where you're teaching about it, you have like a ball or something else that has glitter on it, and you pass it around while you're teaching. And as you teach, you get a visual and see how easy it is to pass germs from one person to the next person, and then you have a good basis for why it's necessary to wash your hands. Another interactive activity that we thought of was the glow activity. So you have like a special lotion that you put on your hands, and then you look at them under a UV light, and then you go and you wash your hands, and then you go back under that same light, and you can see where germs accumulate more and where they're harder to wash off of. So here's some food prep fast facts, and these fast facts are really what we focus most of our lessons on. We went back and forth deciding if we wanted to teach like people who owned restaurants in Ecuador, or we wanted to focus just on general hand washing. And so we focus on just on simpler general food preparation facts, because a lot of these are really basic and many people in Ecuador cook, so these are important things for everyone to know. The biggest one that we focus a lot of our lessons on are using separate cutting boards for vegetables and meat, and teaching the different bacteria that can go with meat, like E. coli for ground meat and salmonella for chicken. So that's a lot of the activities we focus on, was educating about the different things.
Along with a specific curriculum to encourage hand washing, we also wanted to make hand washing more accessible to people. So we brainstormed a lot of different ways that we could do this, and we decided on trialing hand washing or hand sanitizing stations. We would start with using them in high foot traffic areas and bigger cities, and if we see good use of them and success about the awareness of hand washing, we would then move them to some smaller communities. We would focus on getting them to close to food vendors specifically. This not only would encourage usage of the stations before food handling, but also before eating the food. But when people see the stations themselves, it will create an awareness of the importance of hand washing. As far as actual stations, we looked at two options. The first is a hand washing station with soap and water. The next is a hand sanitizing station rather, with the sanitizer that doesn't need water added to it for usage. The biggest difference between these two, and an issue that we saw, was the water source. With the hand washing station, having to find a water source to have it hooked up to or to continually refill the water source seemed really complicated, and we probably wouldn't have the manpower to keep that up for a very long time, and we wanted something that could last a long time and that would be sustainable for a community and just help the initiative of hand washing and hygiene going through time. With that in mind, we decided it would be less complicated to just have the hand sanitizing station. So having decided on the hand sanitizing station, we started thinking about how they could be put in the community where they could go through a lot of wear and tear and last a long time. So to ensure that the station would be in the same place for a long time, we decided that putting the base in cement would just help give it a strong base, wouldn't be able to get moved around by anybody, and it would just help with the maintenance of the dispenser, if the base was strong, then we could just focus more on the dispensers instead of having to always be repairing like a flimsy plastic base. We also decided that one person per city would be hired to be in charge of the hand sanitizing stations. So they would be in charge of keeping the hand sanitizing stations full and to maintain the station. So this includes being in charge of ordering the hand sanitizer when it's getting low. It would also include ordering any either fixing parts to the hand sanitizing station or ordering any parts that need to be replaced. If a dispenser is completely broken, they would be in charge of removing it and installing a new one. Anything else that would come up with the hand sanitizing stations. So money for this would come from both donors and also from some of the fees that would be accumulated from the classes that were talked about earlier. Hannah is going to talk more about specific ideas we came up with to overcome some of the barriers pertaining to the costs of this part of the program. Ultimately, we hope that these hand sanitizing stations will create that awareness that I mentioned before, and that will translate into people's homes where they can understand the importance of hand washing, understand cross-contamination, as was mentioned before as well, and so that these preventable diseases are not an issue for these families anymore, and especially for the younger children that can be really impacted by these different diseases.
The main barriers that we came across while planning this program mainly had to do with our resources and materials that we would need to implement our program. And the main one was finding materials to build the hand sanitation stations. We wanted to try and find materials that would last for long periods of time before replacement was needed. And then we would also train individuals to be able to refill the stations and be able to have upkeep on them so that they would last longer and that the public would use them. To be able to fund our program, our intervention plan had the idea of having the target population contribute to the program. We want the individuals to pay a small service fee when they attend the class, providing details and education on how to prevent cross-contamination and for personal hygiene. The small, affordable price paid by the people when they attend the meeting will help them to feel part of the program and feel like they do have a part in the program. Our program feels that if they have invested a portion of their money into the program, they will be more willing and motivated to participate and apply the new skills we have taught them in their day-to-day lives. We also wanted to reach out to the Clinton Global Initiative, also known as the CGI. Their mission goal is that they convene global and emerging leaders to create and implement solutions to the world's most pressing challenges. The people that are part of this agency are individuals who have money and great influence. By reaching out to the CGI, we'd be able to find funding to provide hand sanitizer stations for the population in Ecuador. We would also be able to provide lectures on hygiene and cross-contamination so as to prevent diseases that are caused by personal hygiene and from foodborne illness. The funding from the CGI would help our program become a reality.